Hey, good afternoon, everybody, and welcome to Friday. It's a rainy Friday here in Florida. I think in a lot of the areas around the area. So, again, welcome to you all. We're going to be talking about men's health in November. It's Men's Health Month. That sort of focuses in on prostate health. So, we're going to talk today, as a beginning of these discussions over the next couple weeks, about a new key to earlier, more accurate testing for prostate cancer. We'll get started here in 1 minute. The information you hear on the Nutrition Shop Health Talk with Dr. Len is strictly educational and is not intended to diagnose or treat any disease. Any healthcare decision should be discussed with your health professional. And now, here is Dr. Len. And again, prostate cancer is, as far as 2020 and beyond, the number one cancer in men. Used to be lung cancer. Used to be then skin cancers. Now prostate has risen to the top. Many things we'll talk about in this upcoming month. But from the University of Birmingham, we want to talk about a new test that was just recently developed that could help us diagnose problems much earlier. We'll get into that right after our national anthem. The number to reach our office, 678-228-8900, 678-228-8900. The product that we're going to focus on in the month of November is a product simply called PSA. PSA by Nutritional Frontiers. It's a saw palmetto extract on steroids. Just joking. It's a very effective tool to lower inflammation and keep prostate health in line. Best that I've seen. Even though you see commercials on TV for all of these different preps, this one is by far tops on the list. You can find out more information on our website at thenutritionshop.net or simply call our office at 678-228-8900. A new type of test that uses complex sugars to detect prostate cancer earlier with greater accuracy is being developed by researchers from the University of Birmingham. The test works by identifying sugars known as glycans in the blood. This is rusty sugar. This is creme brulee sugar. Sugar that's overconsumed that tends to be oxidized in the body. These sugars are attached to protein molecules called PSA. Heard that before? The most distinctive test that has been used for decades, not real accurate, prostate-specific antigen, and again, one of those markers that doctors use almost exclusively. These sugars are attached to protein molecules called PSA and are known to undergo distinct but subtle changes when cancer is present in the body. Particular types of glycans are associated with different cancers, but until now, there's been no technology available to detect the glycans in an accurate, timely, and sufficiently specific way. Research team led by the University of Birmingham School of Chemical Engineering has now developed a technique that can identify glycans associated with cancer with unprecedented accuracy. The technology has been patented by the University of Birmingham. It works by using a synthetic carbohydrate material to create a mold of a specific glycan. These receptors are then fixed in position on a surface, so they bind to that glycan, but not to any others. Professor Paula Mendez in the University of Birmingham's School of Chemical Engineering is lead author of the paper. She says, what's really exciting about the technique we developed is the ability to pinpoint glycans with such specificity. A PSA molecule can have 56 different sugars attached to it, but only 4 are associated with prostate cancer. With this test, we're able to identify those four with certainty. The number of glycans identified in this way will show not only if cancer is present, but how aggressive or advanced the cancer is. The research results are published in the Journal of Advanced Functional Materials, and the team expects to begin applying this technique to clinical samples in the laboratory later this year. A new test for prostate cancer is urgently needed because current tests are only able to give an indication of increased PSA in blood samples. This can give false positive results in more than 50% of the cases. This is because a man's PSA level can become elevated for a number of different reasons, not necessarily related to cancer. In addition, around 25% of men who do have prostate cancer do not have elevated PSA, so the test fails to diagnose these patients. Professor Mendez said, many patients undergoing the PSA test will be falsely diagnosed, causing them to be sent for further, more invasive tests like biopsies that places a lot of stress on the patient, as well as being very expensive for health services. Just as worrying, men who have low levels of PSA that don't show up well in tests. By measuring the glycans, however, we can offer diagnoses that are much more precise, not only detecting cancer at an earlier stage, but identifying how aggressive it is. The team also hopes to be able to apply the technology to detecting other cancers that have already started to develop a test for ovarian cancer. Ovarian cancer is typically detected at a very late stage when treatment options are very limited, and so survival rates are very low, explained Professor Mendez. Because our test is highly specific, it should be possible to apply it to a number of different types of cancer. The research was funded by Prostate Cancer UK as part of the charity's Research Innovation Award Scheme. At an early stage, this research could make PSA a much more specific and accurate way to not only diagnose prostate cancer, but also tell who needs urgent treatment, whose cancer is less aggressive, and can safely be watched. Ultimately, this could help us cure more men and harm fewer. What we need now is for fantastic research like this to be able to be continued beyond the current COVID-19 pandemic. Amen to that. So there it is, a new test coming soon to a urology center near you. But in the meantime, at least get your PSAs checked, at least have an internal done yearly, and make sure you're taking the right prep. And that prep, men, called PSA, can be extremely important. Here's a little piece on consults. Listen up. Hi, everybody. This is Dr. Len, and I want to talk to you today about a consultation. A nutritional consultation. What's that all about? It's what we do. It's a personal one-on-one time that we put aside, whether it be via social media or Zoom or in person, where we can have the ability to work closely to enhance your health. The aim is to enhance your bodily functions, alleviate symptoms of illness, improve your lifestyle through a nutritional intervention. Some people simply want to undergo a diet to ensure they're eating correctly and avoid illness. Other people have medical problems or are suffering from various symptoms that they believe can be alleviated by making nutritional changes to their diet. Other common reasons to undergo a consultation include a desire to lose weight, digestive issues, skin complaints, low energy, lethargy, stress, fertility issues, competitive sports, the list goes on. Before your consultation, we'll ask you to complete a comprehensive questionnaire. This questionnaire will focus on all aspects of your diet and lifestyle, medical history, medications you may be taking, current health concerns, and really importantly, your goals. We may also ask you to do a food and drink diary for those 3 days, maybe up to a week, so we can document everything you eat and drink during that time. Once you've completed this questionnaire, we'll look it over, and then we'll have a one-on-one consultation, usually about an hour to an hour and a half. And during that time, You'll talk through the questionnaire and diary as well as discuss your lifestyle, your current exercise regimen, your health concerns, your family medical history, your existing symptoms, and really importantly, again, your goals. You can also discuss underlying emotional issues that may be affecting your mood, eating patterns, lifestyle. During this in-depth discussion, you may be asked to do some functional tests, saliva, blood, etc., to try to pinpoint specifically what's going on. Once we have a full and complete picture of your current nutritional, physical, and emotional situation, we'll develop a plan for you. That may involve some nutritional dietary issues, working with our dietitian, working with our chef, or supplements. We can add those to the regimen as well. Vitamins, minerals, fiber, fatty acids, amino acids. But to get the most out of a nutritional consultation, you need to be as frank and honest as you can. The more complete picture that we have of what's going on in your system, the better that we can help you. If you're interested in getting started, give us a call, 678-228-8900, or reach out to us through our website at thenutritionshop.net. Okay, that's the information you need. Call our office at 678-228-8900. Tomorrow on the show, at 9 o'clock tomorrow morning on Saturday, we're going to talk about neurotransmitter testing. We're going to go into, maybe not in depth really deeply, but about what it's all about and a little bit more about what is necessary and why I recommend this test so often. So we'll talk about that again tomorrow morning. I look forward to seeing you there. All right, folks, God bless you, and we'll see you back here again tomorrow. Have a great, healthy day, and please, hear something you like, please share it with others. Take care.